This hearing of the Senate Foreign Relations Committee Subcommittee on Africa and Global Health will come to order. Just last week, the World Health Organization declared the West Africa Ebola epidemic no longer constitutes an international public health emergency. However, this does not mean that the affected countries of Liberia, Sierra Leone, and Guinea have fully recovered from the epidemic. Today's hearing gives us an opportunity to examine West Africa's road to recovery from the deadly outbreak of Ebola that in 2004 that infected more than 28,000 people, took the lives of more than 11,000 individuals before the epidemic was brought under control. The epidemic decimated already weak healthcare systems in the three affected countries. It also has continued to wreak havoc on their economies, complicating recovery for governing institutions and hampering a return to normalcy for the citizens of those countries. There have been a number of so-called flare-ups of Ebola since the primary outbreak was brought under control, including one ongoing outbreak that has already claimed the lives of at least 7 people. Now, the U.S. government provided $5.4 billion in emergency appropriations at the end of 2014 to assist affected countries in their response. More than $2.5 billion of this funding falls under the oversight jurisdiction of this committee. Now, more than $1 million of assistance remains unobligated, with some of it set to expire at the end of the fiscal year and the remainder to be available until expended. This is a substantial amount of money. It's incumbent on this committee to examine the successes and the failures of U.S. efforts to assist in the Ebola recovery efforts. This hearing is especially timely given the news reports that indicate that the White House will ask Congress to reprogram $589 million of existing unobligated balances to address the Zika virus, and some of this will come from funds appropriated to fight Ebola. At the height of the outbreak, this subcommittee heard testimony that called for the establishment of first-rate healthcare systems in the affected countries. I think we all share that goal, and it's important to remember that simply providing affected countries with the tools they need to stamp out diseases like Ebola is not an economically sustainable model. This kind of health infrastructure necessary to address these outbreaks while providing other health services can only be sustained by the affected countries themselves. Is the U.S. helping these countries to put their healthcare systems on a path to self-sufficiency? Have we helped mitigate second-order impacts of the epidemic by focusing assistance in a way that helps facilitate economic recovery and development? The physical accessibility of health services was a problem before the Ebola outbreak, as was the access to clean water for drinking, hand washing, and other activities central to proper hygiene. Are we working to continue these kind of systemic, or to address these kind of systemic problems that will likely contribute to recovery and certainly contributed to the severity of the outbreak? We will examine whether our assistance to affected countries is complete enough to consider reprogramming Ebola money for other matters. Will that programming come at the expense of long-term efforts to help economic recovery in the affected countries and to ensure eventual self-sustainability of healthcare systems by the countries themselves? These are questions that we want to answer. Lastly, it should be noted that the Ebola recovery funds were appropriated using a supplemental appropriations measure. These funds are not subject to spending caps established by Congress, and they're not part of any long-term strategic planning effort. As Congress prepares to potentially consider appropriation of another tranche of emergency supplemental appropriations, this time to combat the Zika virus here in the U.S., it's worth examining whether this method of appropriating is effective. Does it result in smart investments, or is there pressure to simply get the money out the door before it expires? I look forward to hearing from the witnesses today. I'd like to thank them for taking the time to meet. I've met with each of you before, 3 of you in my office before, and I appreciate the time and effort you've put into the testimony that you're going to give us today. And thank you, and we'll return now to the ranking member, Senator Markey.